In discussing hormone therapy for breast cancer, my preference is to use the word anti-hormone therapy. Now, what are we talking about? What's the role of anti-estrogen medications? In premenopausal women, that's tamoxifen. And in post-menopausal women, that is typically a category of drugs called aromatase inhibitors. Now, the good news is that the majority of breast cancers are hormone receptor positive, meaning the estrogen receptor and or the progesterone receptors are positive. These are receptors on the cells of breast cancers. And the concept here is to turn off those receptors, hit an off switch, if you will, to theoretically then put those cells into hibernation, turn those cells off, hopefully keep them from proliferating. Now, why do we do this? Well, we've known for about 30 years that we have to treat the whole body once a breast cancer is invasive. And remember, invasive means growing out through the walls of the ducts, because when that happens, patients are shedding off cancer cells that circulate around the body, and sort of like throwing grass seed out the window, those cancer cells have the potential of setting up shop elsewhere in the body, in the bones, lung, liver, etc. And so part of the systemic or whole body treatment of breast cancer then is the use of anti-hormonal agents. Most recommendations today are that those anti-hormonal medications, tamoxifen or the aromatase inhibitors, are generally used for a minimum of 5 years. There are certainly circumstances where extra time is being recommended. In the future, we may find women on anti-hormone medication for many years, particularly the more advanced their cancer was initially. So remember this, that the use of anti-hormonal therapy is part of the systemic treatment of breast cancer. Also, there are some benefits that are important to these kinds of therapies, including the potential to prophylactically decrease the risk of getting a cancer in the unaffected breast, and if you've had breast conservation, lowering the chance of the cancer coming back in the affected breast. So there are many roles. Like everything we do in breast cancer, there are benefits and there are side effects. You need to check all these things out, but remember the concept, we're treating the whole body. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.